the reason I'm here today is just kind of talk about common blood disorders, and we'll really focus on one particular area because I find that's the most common area that general hematologists see, and I think the common area that people often get referred to us as hematologists. So we'll talk about common blood disorders, and we'll really focus on anemia. We'll talk a little bit about what exactly anemia is. We'll talk about who's at risk of developing anemia and certain populations. And not surprisingly, all of you are one population that's actually at risk. And I think that's why this is an important topic. We'll talk about some of the roles that vitamin supplementation can take place and where that's important, as well as some of the prevention and treatment that you can do ahead of time to prevent, in order to not develop anything. So we'll talk a little bit about the basics of the blood system. One of the things that I found every patient that I meet and try to explain their blood disorder, I start out with explaining kind of the basics of the blood system and what are the things that we are looking at as hematologists to try to help figure out the problem or the solution to these areas. We'll talk a little bit about why some of the reasons that people become anemic and mostly focus on different dietary areas where people can become anemic, but other areas where that could lead to it as well. And specifically, we'll talk about the roles of iron deficiency, as well as vitamin B12 and folate deficiency, which are probably the three biggest areas of nutrient or vitamin deficiency that we deal with that leads to significant problems in the blood system. So what is the blood system? So as Dr. Dindal said, it's one of the very important systems in our body. And in fact, I think all specialists within medicine argue which is the most important body part. The cardiologist will tell you the heart is the most important. The neurologist will tell you the brain is the most important. But in fact, none of those things really function very well without a blood supply to any of them.
Excuse me.
And the nephrologist, I'm sorry. But one thing that links every single part in our body starts out with basic nutrients, but also our blood supply that helps deliver them as well as utilize them very importantly. So when we talk about different elements of the blood system, we talk about the red blood cells, which main function is to carry around oxygen to our tissues and to our different organs. The white blood cells we primarily think about as an infection-fighting mechanism, but also things like inflammation in our body. So, for example, one of the components of somebody developing arthritis can be an inflammatory response, which is normal that they can see. And finally, we talk about platelets, and they become very important in the development of blood clots to help you prevent bleeding. And all three of these are highly kind of dependent on each other. And more importantly, one thing that we look at as hematologists is we look at the complete blood count. So whenever you're getting a blood test done, this is actually one of the most important components for us is what are the different counts of each of the individual types of blood cells that are there. And it gives us a lot of information on those three main types. And so what we look at with all of those is, are they normal? Are they high? Are they low as well? To try to determine where the issue kind of lies. And how do we determine a normal? Well, we usually take the majority of the population who are healthy and well, and we figure out where their value lies within all of this. And if you fall within that majority, we assume that you're normal. There's always about 5% of people that fall below or above that normal. And they might be completely healthy as well. And so some of the patients we see in clinic at times can be people that fall within these low or high ranges but are actually perfectly healthy. And so one of the most important tools for us is not only the values that we see from somebody's complete blood count, but actually the history of these over time as well. So if you're somebody who's always been high or been low, we'd like to know that. Or are you somebody that suddenly has developed a new problem? And can we, from either your history or from the history of your blood work, can we figure out where something has changed within all of that? So as I said, anemia, there's different terms that people can throw around, but generally we talk about too few red blood cells that are in the system. And that is typically what we would call anemia. One of the main measurements that you might hear people talk about with regards to this is the hemoglobin level, which is really a concentration of one of the components within these red blood cells that carries around your oxygen. And so when we talk about anemia, we often refer to that as the main value that we follow. We also throw out terms that we talk about highs and lows, and so polycythemia is actually when you have too many red blood cells that are in the circulation. Infections can cause rises in white blood cell counts, actually can cause lowering in white blood cell counts as well, but it's not the only cause for somebody to have a high white blood cell count. So the white blood cell count actually fluctuates with lots of different environmental stimulus or different things that happen to your body. Another thing we look at with the platelets as well as your blood profile is we try to figure out if you have a bleeding disorder as well. So, for example, somebody comes in with a bleeding history, meaning that they bruise easily, or when they cut, they bleed excessively compared to normal. And one of the things we look at in that is try to figure out, is this somebody that has a bleeding problem or not? So why is it important? Again, problems with the immune fighting system as well, infection fighting system. So we look at the blood counts. We try to see if the white blood cell counts are too low. We try to figure out, well, are you more prone or at risk of infections as a result of this? And sometimes that value can kind of help us to try to figure these things out. And more importantly is we also look at the blood counts in this blood system to try to figure out what the factory is doing. When I say the factory, I'm talking about the bone marrow. And this, for us, is the primary place where all of our blood cells grow. And really, what we try to look at sometimes with our blood results that we have is how well is the factory working? Does it have all the supplies that it needs to actually produce the final product, which are the white cells, the red cells, and the platelets in the end? Is there a problem within the factory, and can we sometimes try to figure out what's going on there? So let's talk a little bit about anemia, and we'll talk about anemia as a group, and then we'll talk about the three different areas that I'll focus on today in terms of causes of anemia. So some of the symptoms that people can experience: weakness, fatigue, headaches, irritability, difficulty exercising, sometimes difficulty breathing as a result. The trouble with a lot of the symptoms of anemia is they are not specific for any one thing. If you were to look at the different causes of weakness or the different causes of fatigue, there's probably hundreds of different things that we could list off in terms of a cause. So often the difficulty is trying to figure that out, which is often difficult on a history itself, which is why I said the blood counts are important. One thing I always tell people as well is that even if you're anemic or your red blood cell count is low and you feel fatigued, I often warn them that fixing that anemia or fixing that red blood cell count is not the same as resolving their fatigue or their fatigue or their weakness, because often you can see an improvement in one but not have the improvement in the actual symptoms. So it can improve your blood counts. Difficulty exercising can often have lots of different causes. As lots of us, there's so many of us that we are very fit at certain ages in our life, and as we get older, we don't tend to exercise as much, or we cut back in terms of how much we exercise. There tends to be a gradual slowing in how much endurance or stamina that we have. Some people notice that very quickly, some people notice that more gradually. So often, we have to try to figure out, is there a gradual change in these things, or is this something that's happened very quickly? And again, can I make the correlation between my blood counts and this, or my vitamin deficiency and this, to try to figure out if they go together? The difficulty often is that a lot of people have other medical issues, so whether it's lung disease, whether it's heart disease, that may slow them down as well. That's why these symptoms are not very specific. So let's talk a little bit about iron, because I think this is probably one of the biggest areas where, or more common areas that people have a deficiency in a vitamin or in an element that leads them to have an anemia. And there's very good reasons for this. Iron is really essential, and it's not only just for our blood system, but for all of the cells in our body. Iron is a very important element to have just for the normal functioning of cells. The difficulty is that iron, because of its very nature, is a good and bad thing. In too high concentrations or not in the right control, iron actually becomes very toxic to the body as well. So as a result, our body has developed a lot of mechanisms over evolution and time to try to keep iron in a very regulated manner so you can't cause more damage. And this is also one of the reasons why it becomes difficult to absorb iron, to get iron into the body, because the body is protecting itself from taking in too much. Again, because of evolution, because of periods in our lifespan where we might have faced problems where food was scarce, those kind of things, our body has actually developed mechanisms that we keep iron. So about 98% of the iron that we have in our body is actually recycled. And so we keep it and try not to lose it. So and again, as I said, we limit how much goes in as well because of the toxic aspect of it. And so most of the iron that goes in is absorbed in through the stomach and the intestines. And actually that is the main site of loss as well, unless you have another reason to lose iron. And one thing I found interesting is that, you know, most vegetarians, and the reason they get into problems with iron deficiency and maybe leading to anemia is that they require far higher amounts of iron intake. And part of the reason is that plant-based irons, or irons that are not from animal products, are typically harder for the body to absorb. And we don't really know why the mechanisms are that different between the two. Over the last couple of years, probably over the last 5 years, our understanding of how iron is regulated in the body has gone from probably about 5% to about 75%, meaning that our knowledge has really changed. But we still don't understand basic things like different forms of iron in plants versus animal products or meats and things like that, and why they're absorbed differently, or why there's so much difference between the two. But we do know that the plant sources are not as easily absorbed. Some quick iron facts. So the average content of iron in men or women is about 35 to 40 milligrams per kilo. So if you have to multiply your body weight to try to figure out how much iron, and about 95% of that is actually stored in your red blood cells. The other stores of iron are places like your liver, for example, muscle sources, things like that. And because of the normal cycle that women go through every month, they actually have less iron stores overall. And in fact, one of the reasons why they have lesser values, and in fact, there's also hormonal variations between men and women that actually cause them to have differences in overall iron values. As I said, most of the iron that we have is stored in our red blood cells. And as you can probably imagine, if very little is coming into the body, most of it is actually recycled. As long as you're not losing your red blood cells somewhere, you should maintain or hold on to a good amount of your iron that's in your body. Dietary iron accounts for about 15 to 25 milligrams of intake. Unfortunately, even if you take in that 15 or 25 milligrams, you're only absorbing about 10% of that on a daily basis. So most of the recommendations that you see out there about how much iron intake that you should have are really based on the idea that you're not going to absorb as much as you take in. So we're really trying to maximize how much you take in. Depending on your underlying medical issues and things like that, so for example, somebody who breaks down their blood on a regular basis because of some problem with their red blood cells, they can actually absorb about 10 times more through the intestine than a normal individual. So on average, we require probably 1 or 2 milligrams of iron intake every day, and this is, and so one thing I want to make distinct is this is what we call elemental iron. So this is the actual basic iron state, because you'll see a lot of other different numbers in terms of total iron. So one good example is the most common iron replacement strategy that we use is iron pills. And an iron pill is designed as 300 milligrams. The amount of elemental iron in that is only 30 milligrams. So there's a huge difference between the two. And so all of these numbers that you're seeing are elemental iron. And we'll talk a little bit about different oral irons or different iron replacement that you use as well. So, as I said, intestinal iron absorption is really what we're trying to battle against. We're trying to improve that, or that's where we're really limited. So our typical diet actually consists of 90% of these inorganic irons from plant-based sources, things like that. And so we actually have a hard time absorbing most of those. 10% of them come from what we call heme irons, and this hemoglobin molecule is what is within our red blood cells. And this is actually the iron that is most readily absorbed. So as you can imagine, if you are a vegetarian and you eliminate that 10% right there, you're eliminating a large intake of your iron sources. Now there's lots of other ways that you can get iron into your system, and we'll talk about different food items and things like that can actually help. Other things that help, that alter your ability to absorb iron, well, if your iron stores are actually very good, your body is designed to not absorb as much iron, so you will stop absorbing more. If your blood levels themselves are good, so you're not anemic, your body is actually designed to do that. And again, this goes back to the idea that iron is a toxic substance and we want to limit and regulate how much goes in. Your blood oxygen content. So if you live in the Himalayas, for example, your body, because you're constantly low in oxygen, or the oxygen is lower there, your body is actually designed to increase your red blood cell production as a consequence, and try to help this. You'll initially take in more iron probably to help that production problem. But eventually some of that will change and maybe balance out. The other thing that's really interesting, and we see this a lot, is that people are often sent to us because they have other inflammatory disorders within their body. For example, somebody who has severe rheumatoid arthritis or other autoimmune diseases. And the difficulty becomes trying to figure out what the source of their anemia is. We always try to rule out that somebody isn't losing blood from somewhere. But often we end up in the situation of finding somebody that just has a chronic inflammatory problem within there. And this kind of stems back to the infection part of things. Your body's designed, again, to regulate iron. Bacteria need iron to actually survive. And so during an inflammation or infection, those kind of things, your body actually shuts down its ability to absorb iron because it doesn't want to feed the illness and it doesn't want to feed the bacteria. The downside is that, well, there's a lot of illnesses that we live with that use this same mechanism, or it cause the body to shut down the iron absorption or iron utilization. As a consequence, we actually get anemic, which is it's the unfortunate part of a good mechanism to help us protect from other things that goes a bit too far. Other things that are also important, what you eat iron with. We know that having a bit of acidity in your meal actually helps iron absorption in the stomach. And in fact, vitamin C, which is also ascorbic acid, actually helps your body absorb it. So one thing that's often recommended, whether you're taking iron supplementation or something that's heavy in iron, is actually taking it with orange juice or something that has a lot of vitamin C at the same time. So what are some of the causes? Why do people get into iron deficient states or low iron states? Probably the most common thing that we see is women within their menstruating years. So women generally have lower iron stores as a result of this. If Over time, women have very heavy periods, and as I said, not too much ability to absorb iron. They can get into difficulty where what's iron stores are leaving their body compared to what's going in is not balanced properly. So very commonly we see women anywhere from the age of 15 to 50 who have very low iron stores and are anemic as a result of that. Other things that we have to look at, though, are gastrointestinal tract. So one of the main areas that we often get referrals is low iron, and we always want to make sure that there isn't a reason within the gastrointestinal tract that somebody's losing iron, whether that's because they're not able to absorb it itself, so that's the second part, which is the absorption problem, or whether it's because there's something that's bleeding or something that's going on within the tract. So one thing that you might find surprising if you're ever to see a hematologist with low iron is that we actually send you to a gastroenterologist to try to figure out, are you losing iron somewhere that we want to find out about. Other reasons, so diet is certainly a big factor. So do you have an appropriate amount of intake? Do you have a diet that's restrictive? So vegetarian diets, as I said, don't have as much iron content, or if they do have a lot of iron content, they don't have that readily available or easy absorbable iron. But other people with dietary restrictions as well. Other things can actually slow down, so lots of bran and lots of fiber can actually decrease the amount of iron that you absorb as well. Pregnancy is often a time where people need more iron because your baby's stealing some of the iron from you or stealing your nutrients away from you. So if you have very little stores of it, then your stores are going to be even lower at this point, which is often why a multivitamin is recommended during pregnancy to help replenish some of these. The other two are often things that we see as hematologists. So if for whatever reason your blood has a reason to break down, whether it's because of an immune problem or whether it's because of another illness, then your body will slowly probably become depleted. Now most of that, as I said, you will reabsorb, so that's usually not an issue. And then you actually, in those conditions, will absorb more from the intestine as well. Very rarely we do see people that, for whatever reason, have a congenital issue where they cannot absorb iron. So what are some of the dietary requirements that we kind of talk about? So the major categories, as you can see, so men around 19 years or older, we only need about 8 milligrams of elemental iron a day. So it's not a huge amount, but certainly that's what we need. And as I said, because of the toxic nature of iron, we try to stay below 45. Now, does that mean that if you had 45 or 50 milligrams a day of intake of iron, are you going to run into trouble? Not typically. Right? But it's just not recommended that we go above that amount. As you can generally see from these trends, though, women kind of either in their childbearing years or women who have not gone through menopause and are still having monthly periods need more iron. Right? You're having that monthly loss and you need to compensate for it by increased intake. But as women get older, they don't have that monthly loss. We actually don't need that anymore. And in fact, if you look, women will tend to build up their iron stores again later down the road. And not surprisingly, as I said, pregnant women need a fairly high intake of iron during the pregnancy to compensate for that stealing away of their iron. So what are some of the features of anemia related? So this is the low red cell count that you can see. So some people can actually feel perfectly fine. I met an 85-year-old gentleman who had probably been anemic for 6-9 months or more, but was still swimming every day, was still jogging every day, and it's because of the gradual loss or gradual slowing down. And in fact, he became used to it to the point where he didn't actually notice at all. But as I said earlier, some of these non-specific symptoms like weakness, headache, irritability, and fatigue can go with all of this. If you're somebody who has underlying heart disease, whether you know it or not, as you become more and more anemic, as that oxygen supply that your heart would need goes down, you actually might notice chest pain or chest discomfort, which actually may also manifest as breathing difficulties. This one's going to be a little bit controversial because confusion can be caused again by many reasons, and I don't think there's necessarily a direct link between somebody who has dementia and anemia. Having said that, certainly can worsen some of the symptoms that may already be there or underlying. And more importantly, some people can notice that their breathing is off. So, taking that flight of stairs seems a lot more difficult now because of my anemia compared to a couple months ago or even a year ago. Again, that's one area we always have to be careful about and make sure there's no underlying lung disease or heart disease or something that may also be the cause or may also be making these things worse. So some of the other symptoms that I mentioned that may not be related to the low blood counts themselves or other extra features. So we talked about fatigue and headaches. Pica is this urge to actually eat dirt. And so it comes back from a very long time ago where people very iron deficient, and so they want to eat dirt. Pagophagia is actually the want to need ice. So crunching on ice actually, for whatever reason, that's been there. And there are patients that we see that complain that at night specifically they have a lot of restless legs. So constantly kicking or moving their legs throughout the night often interrupts their sleep. There are actually several people who, when they get their iron replaced and their iron levels improve, their anemia improves, those symptoms actually get better. But those symptoms can actually be, so whether you're anemic or not, some of these can be present. And hair loss, again, can sometimes be just a subtle sign that maybe there's something else or deficiency in the body that of requirements.